bones in knee pain and what exactly happens and how physiotherapy can help with it. In today's session, we will be discussing about what are the basic guidelines or the physiotherapy exercises which are safe to be done at home if you have mild knee pain. But understand that just an advice, but if you have severe pain, moderate to severe knee pain, it is always advisable that you visit your healthcare professional. Hi, I am Dr. Apurva Kadam Thakkar from Team Joints and Motions, and today we will be discussing about the safe, gentle exercises which you can do if you have knee pain. Okay, so as we discussed the knee artery, we discussed about knee arthritis and what exactly happens in knee arthritis. So just to gist, that arthritis basically is the erosion between the joint surfaces. So why are we doing the exercises? So that the supporting structures, the structures which are there above and surrounding the knee joint will support the knee joint and help to improve the functioning and reduce the pain. So what are the basic structures? The main important structures is the quadricep muscle here and the hamstring. So basically the hamstring and quadricep along with the abductors, which are the side muscles, so it does this action, sideways action, are the important muscles which play an important role. The most important muscle here is the quadricep. Why? Because the muscle narrows down to become a tendon which attaches, which goes above from the patella and attaches here on the tibia. So the patella functioning and the movement of the patella is also has a lot to do and with the quadricep functioning and the strength. So the most important things that we are going to learn today, your basic movements of your knee joint should be free. Okay, so a lot of patients are being advised that don't move the knee joint or don't walk or don't do this and that. Of course, walking, standing, cross-leg sitting has to be done as per your pain tolerance range, okay? But gentle knee movements should be fine. So for example, if you say that while you're doing this movement, your knee starts to hurt in this range, after this range. So make sure you are at least moving in the pain-free range. So you're in this action, this is called the knee extension. So this action is also done by the quadricep. So you can do basic movement. When you do dangling movements of your knee, basic pain-free movements, the pain in the knee also subsides. So basic dangling movements of your knee are fine. And knee extension, if you are able to do this pain-free, you should continue doing it pain-free. And if you have pain after this range, you can just move your joint till this range. Now if you say you have no pain at all, you can just take it up completely. Make sure your back is not slouched when you're doing this. You have to make your back straight and straighten up your leg and hold this 1, 2, 3, 4, 5 and then bring it down. Okay. So this will help to increase the strength in the quadricep. Okay. If you have pain here, पीछे का जो अगर पेन होता है ये करने के टाइम you feel that this movement is not complete, that means you have little tightness in the hamstring. So you have to make, this is not personalized and tailorized approach. So if you have any other concerns while doing this exercise, make sure you visit your healthcare professional or feel free to ask us. Then the next thing which is important is the quadricep activation. Okay, so you can do this in lying down position also. That will be more beneficial. So you just have to place a small towel roll like this, firm towel roll, and you have to just press your knee joint down. Okay, so you have to just press your knee down, hold 1, 2, 3, 4, 5, let go. Now a lot of patients ask what should be the ankle movement. If you keep your ankle movement up, that will be more beneficial. So press it down, 1, 2, 3, 4, 5, let go. Okay, so this is also again for the activation of quadriceps. So now a lot of patients, what they do is, I'll show you in lying down position. So a lot of patients, they lift the pelvis up. So they put more pressure like this and this is coming up. So when they are pressing the knee, this also is moving because the muscle strength in the quadricep is less. So this part is also moving. So make sure that you are isolating this and there is no trick movement from here. So only pressing, ankle up, hold and then let go. If you have pain even while you are doing this, you can just fold up so you can make this little wider, place it under your knee and then you then you press it. Okay, so now this movement we don't want it to happen. We only want the quadricep activation. So pressing, hold, let go. If you find it difficult to even hold this position, you just have to press, let go. Press, let go. Okay, ankle can remain up in this, but you don't want this movement right now. Okay, so this is the first thing what you have to do. So I told you that if you have pain while doing it with the towel roll, you have to make a bigger towel roll, keep it here and press. Okay, so this is supposed to be done. Now say that you don't have, if you have pain even with this, you can further increase the towel spacing and press it. So that will help to activate the quadricep muscle. Okay. Then you also press it and take your heel up. So this is also again for the last degrees of knee extension. So you can hold. So if you have pain in this, you can again increase the towel spacing and then increase the you do the knee extension movements. Okay. So this is the main basic thing. Again, we can do these are all isometric. That is, there is no the first knee pressing what we did was isometric. That is, there is no movement of the joint, but there is contraction. Then you can take the towel roll, place it in between and press it inside. So you can press, this is supposed to be ideally done in lying down position. Press it inside. 1, 2, 3, 4, 5, leave. Okay. Press it inside. 1, 2, 3, 4, 5, leave. So now this is for the adductor muscles which are present inside. Okay. So these are the basic things that are the isometric exercises that are supposed to follow. Again one more isometric is you can place it under your heel. Now in this, if you do it like this, your knee will hurt. So slight bending of the knee and then you press your heel down. 1, 2, 3, 4, 5, let go. Again 1, 2, 3, 4, 5, let go. Again this is ideally supposed to be done in lying down position only. Okay. So as we talked about the exercises, here are the few things that are really basic. They will not aggravate the pain at any levels. But having said that, every knee pain is not arthritis pain. So every knee pain patient
Receive
will
2000
not get
rupees on
benefit
Google
from
Pay
this,
for business.
these set of exercises. Okay. So make sure that you are consulting your healthcare professional. You go to your physiotherapist. Understand what exactly is the cause of knee pain. Okay. Because not every knee pain is an arthritic pain. So make sure that you are doing these exercises so that you get maximum benefit out of it, and if not, you must go and visit your physiotherapist to understand what can help you to deal with your knee pain better. I hope you have understood. If you have any doubts, you can connect with us on Joints and Motions. We are located here in Virar.